Hello, I'm Kerry Hall, America's Healthcare Advocate, and I'm here today with Dr. Kelly Logan. As you can see, we're having an ongoing discussion about uses of medical marijuana. As many of you know from listening to my broadcast, I'm a Vietnam veteran. I also know that a lot of my brothers that served both in Vietnam and Afghanistan, Iraq, all of these different theaters of war, come back with serious PTSD. So we're going to talk about the applications of medical marijuana to PTSD. Doctor?
So PTSD is a straightforward diagnosis in Missouri, right? The only kind of loophole here is that with PTSD, Missouri did require that a certified Missouri psychiatrist does say that PTSD is the diagnosis.
Correct.
All right. Most veterans I've met have multiple diagnoses in that list of 9. And so if they haven't had psychiatric care and they do have a diagnosis of PTSD, obviously that helps. So one of the strongest advocacies here in Missouri has really been taking care of our veterans. Dealing with this subject is a hard one, but it works. It's very effective. It improves quality of life.
Well,
it
and one of the
decreases medications. It decreases visits to
Right.
the VA. It improves suicidal ideation. It decreases the number of suicides with our veterans. I mean, there are so many things.
And it's a combination of, understand something here, it's a combination of counseling and the medication. You can't do one without the other and actually be effective, but if you do both, it can be very effective. Doctor?
Absolutely. It is interesting that you say that because it's important. It is a combination of therapy and medicinal products, regardless of what the medicinal product is. But when you notice what your triggers are, then you can identify with those triggers, right? And so if it's something that's more anxiety, social anxiety, depression, it might be a different ratio. If it's more sleep, middle of the night, pain, neuropathic pain from whatever condition. I mean, I see vets all of the time that have so many pain issues, but they also have PTSD.
Right.
Sometimes it's actually easier to talk to them medicinal marijuana with their pain issues rather than PTSD, only because of that one clause.
Yeah, and the other part of the problem is that PTSD, when you are diagnosed typically by a psychiatrist, that you get all kinds of medications shoved at you, and they're very strong drugs.
Yeah.
And those drugs have enormous side effects, and they can be addictive. So using medical marijuana in a situation like this, and I speak as a veteran here, I think makes a lot of sense.
Absolutely.
So, unfortunately, the VA cannot condone this, nor does the VA offer it, because the VA is federally funded and federally regulated.
And absolutely, I want to add in that, I work closely with the VA, but I don't work for the VA. I don't take federal.
No,
so there are physicians out there that regularly talk with veterans and associations and the VA. So we have made connections where the vets have access to those services. And let me tell you, most VA docs really want to be able to offer this. They just can't right now.
Right.
However, we do communicate with them. So they know, hopefully they know where to go. They know where to go. And if they don't, then we'll show them.
We hope this helps you understand PTSD and some of the medical applications of medical marijuana that Dr. Logan just explained. Thank you for listening.